Hi, a very good afternoon to everyone. Well, I'm Kulpreet, Editor-in-Chief, Impact Health. Samita Tiwari is not too well, hence she couldn't, take this session. And as a partner of Aspiring She, I am here. So thank you, Samita, for this opportunity. This is an initiative powered by Aspiring She Foundation on maternal health and childcare. It's a 15-day online awareness campaign. And Aspiring She is taking some amazing and great topics of interest to women and their health. Aspiring She is hosting this online campaign in association with their community partner, Ma to Mom, their health partner, Nurture IVF, and the supporting partner, Impact Health. So today we are here for a chat on newborn care. And for this, we have a special guest, Dr. Brigadier Ashok Saxena, who's going to join us in a bit. He's head of the department and consultant, Neonatology, Pediatrics, Manipal Hospitals, Dwarka, New Delhi. Newborn care is a very important topic to be talked upon, especially in the COVID times when new mothers are, very scared, are fearful of, what is going to happen to my baby? How do I take care of my baby? So all these answers are going to come to us by the expert, Dr. Brigadier Ashok Saxena. And in today's time of Google, when all the parents and mothers just Google every knowledge or everything they want to know, I think it is very important to have knowledge and information from the right expert. And who can be better than a pediatrician and a neonatologist himself, who has over 3 decades of experience and has been a well versed doctor in this field. So we are waiting for him. We'll wait for him for a minute and he will be joining us. So I'm waiting for Dr. Brigadier Ashok Saxena on this very important topic of newborn care. And if you see in the past, Aspiring She has been taking topics, relevant topics of maternal health and child care. I'm waiting for Dr. Ashok Saxena to join us online on newborn care. So, if you look at newborn, parents are concerned, especially mothers are concerned about the nutrition. How do we, feed them? Do we feed, how many times do we breastfeed the child? The mothers are always worried and concerned about that, and what is the timing we should feed our child with? And, what are the signs of underfeeding or overfeeding the child? So these are some interesting, questions which Dr. Brigadier Ashok Saxena is going to answer. And how important is breast milk? Breast milk has been talked about, and in today's COVID times, it's breast milk is full of immunity, and how it is very important for a child's health. There's other very common things like how to massage a baby. Do you we use Kajal or Surma, or what happens with the umbilical cord falls off, and so many other things. So Dr. Brigadier Ashok Saxena is going to answer all of these for us today here on the Aspiring She platform. So while we wait for doctor, I think it's just might be some kind of a tech glitch. I think he will be joining us in a bit. Before he kind of joins us, um, let's talk about newborn care in general aspect. What mothers go through, they go through a lot of information on the Google, and Google is the only source of information which today's parents opt for. However, I think the right thing is to go to your gynecologist or a neonatologist or a pediatrician for the right of information. That's like really important. And that's what Dr. Ashok Saxena is going to share with us. So I've got a message from his office that he's going to join us in a minute. So let's wait for him. And he is a very renowned doctor, has a lot of experience behind him, and the kind of information and knowledge he imparts is like very valuable. And we, as listeners, and I, as a host today, I am overwhelmed to host him, such a renowned doctor, on this very important subject of newborn care.
Good afternoon, everybody.
Good afternoon, Dr. Saxena. How are you doing?
Tell me.
How are you, sir?
I'm fine, absolutely fine. And
Sir, थोड़ा पीछे हो जाएंगे, बैठेंगे थोड़ा.
okay, yeah,
Yes.
yeah. Is it better?
Much better, much better.
Okay, all right, all right.
So I was introducing yourself, sir. I have already done that. And before we kind of go on to the topic of newborn care, I would like you to share with us about your experience at PGI, and you were here in Pune as well. You could tell us about that, and then we can start a chat.
Okay, very briefly, I won't dwell much upon my rather modest achievements, but yes, I did my MBBS and MD Pediatrics from FMC Pune, where Kulpreet is located, and I did, that was way back in, I did my MD in 1989, so that's for 31 years I've been a pediatrician, and I did my DM in Neonatology from PGI Chandigarh. And some of the most important appointments that I've held were I was HOD Pediatrics and Head of Neonatology at Command Hospital Pune, and I was also Professor of Pediatrics at FMC Pune during that appointment. I was also Head of the Department Pediatrics and Neonatology at Army Hospital RNR, which is our apical institution of the armed forces. And I was also Professor and HOD Pediatrics at Army College of Medical Science, Delhi. So I think that should suffice, I guess. So I've been a neonatologist for about 22 years and a pediatrician for 31 years.
Wow. So we have this abundance of experience with us. And before you came in, Dr. Ashok, I was telling the audience that today's parents opt to go to Google to see and get answers to their queries, rather than going to an expert like you and actually getting the right answers for the questions. And today's topic is newborn care. And before we delve into today's topic, Dr. Saxena, I must tell you that Aspiring She is doing this online campaign on maternal health and child care. It's a 15-day online campaign, and we have been doing it for last few days, and it'll go on till 30th of July.
All right.
And
All right.
yes, and we come in as their health partners and supporting partners. I am Kulpreet, and I am editor-in-chief of Impact Health Searching. It's a health portal which has been recently launched during COVID only.
All
Right.
right. All right.
Yes. So, sir, on the newborn care, what is your experience? I have a whole set of questions for you, but before I dwell into that, tell us, what is your current experience on newborn?
All right. So if you look at it, there are two aspects of today's care. Of course, today's talk is about a normal newborn. But if you see, my whole preoccupation is with the sick newborns, rather babies who come too soon in life. For example, today, whole night I was awake with a baby whose mother, had a dire emergency. She bled profusely, so she had to. The obstetrician had to deliver in middle of the night. a 28-week preterm baby. I had to come at night. I had to give surfactant, ventilate. So these are the kind of babies who require surgeries, babies with cardiac diseases. So this is one set of babies that we look after: preterm babies, babies who have who have some malformations of lungs or intestines. So we look after the medical aspect of that management. Preterm babies, as I just mentioned, for example. So there's one set of babies, of course, but after we go through this hard grind of working in neonatal intensive care, it's a pleasure even interacting with the normal newborns. It's a normal newborns, and even they have a lot of apprehensions, a lot of questions. So that's a entirely different. So you can say for me, it's a kind of a relaxing exercise to be dealing with normal newborns.
Yes,
And could be
I can get that. Children are a bundle of positive energy, and I can relate to that definitely, sir.
one thing I just want to say for the mothers who, if they are there, that you mentioned a very nice thing that all the mothers Google. I always tell my mothers that look, God has gifted you with mothering instincts. Just back yourself, be relaxed, and you will get the answers yourself. And we give a handout to all the mothers, and that handout is scientific, yet it is absolutely in consonance with what is called natural mothering. So I feel that mothers, if they have confidence in themselves, they are relaxed, and they don't try to reach out to Google, don't try to ask their friends. They would get the answer themselves. I think if you know what I mean, that mothering is a very, very instinctive thing. Even a mother
Yes.
who's not very educated, even she may know everything about her baby. So I feel that God has given them that capability, and they should trust. So mothers must learn to trust themselves. This is my, I think, a singular statement that I am making, and all my advice that I give is centered around the mother.
That is such a powerful and a very valid advice, Dr. Saxena, that a mother should follow their instincts. And every mother is unique. Every child is unique when they are born. And the process of birthing, process of nurturing, everything is unique to a mother. So very valid point that mothers need to trust their instincts. So being a scientific doctor coming from you, it holds a high value, sir. And I would like to ask you certain questions on newborn care.
Sure.
Mothers are generally very concerned about the nutrition of the newborn. So, what is an optimal nutrition for a newborn?
Okay. Now, if you really ask me, and I think most of us know, in fact, that mother's milk, that is breast milk, provides complete nutrition. It subserves the entire nutritional need of a tiny newborn. So we suggest that mothers, as far as possible, we recommend exclusive breastfeeding. By exclusive breastfeeding, we mean that not even water is to be given to a baby for first 6 months of life.
Oh,
So
wow.
unless there is something to suggest that that is not sufficient, which is very uncommon, very uncommon. We do get such cases, but we recommend, as you when you are. So my answer is we recommend exclusive breastfeeding for first 6 months because it fulfills the entire nutritional needs of a newborn. It subserves the entire nutritive requirement of a newborn. So that's it.
Right. So that's so why so much of stress on exclusive? I've seen young mothers, new mothers, trying to give water to the child or just giving something else. Though yes, first 6 months they don't, but yeah, water definitely they give. So why exclusive breastfeeding?
Right, right, absolutely. Now, as I said, firstly, there are a couple of reasons for it. It's like a first thing is that, as I said, it is enough. You don't need anything else. That's one. Second thing is that mother's milk not only provides nutrition, it prevents all kinds of infections. You take pneumonia, ear infection, stomach infection, various kinds of viral infection. So it prevents so many infections. And if you introduce anything else, for example, water or a supplementary feed, in our country, the hygiene standards are uh, let's say at times can be, I won't say not always, but at times can be suboptimal. So by giving anything else, you might be introducing infection. So here was a baby who was to get, antibodies and other anti-infective factors in the mother's milk, is now being given something which may actually be harbinger of infection. So that means infection prevention is one reason why we say that please stick to exclusive breastfeeding. One. Second thing is, it's very strange. There are mothers who feel that if I give more, something more, perhaps my baby would thrive more. But actually, what happens is when you give formula, the babies gets less breast milk. That means mother's breast milk supply may dwindle. So, you wanted to give amrit to a baby and you wanted to give something more, but then the supply of amrit becomes less, if you know what I mean. That means by giving something else, you might actually be decreasing the breast milk supply. So this is the second reason. Third reason, of course, is we are only now beginning to understand the breast milk properties. For example, it may have some kind of should I say it especially in preterms, it leads to a better neurodevelopmental outcome. That means their their intelligence, their movements, their overall development is better. The preterms who are given mother's milk have better mental outcome, better developmental outcome. So that means good for their development. One. Second, it is also good for their vision, maybe good for their vision. Thirdly, it prevents allergies and it may
Oh,
prevent
wow.
certain malignancies also. So it's such a vast range of benefits that accrue to a baby. That's why we recommend breastfeeding. And as I said, if you introduce anything else, you might introduce infection and you might decrease the breast milk supply. So I hope I've answered that question.
Absolutely, and very rightly so, Dr. Saxena. There's so much of nutrition in breast milk, which is irreplaceable by anything,
Absolutely.
right? I wanted to ask another question here. There are a lot of mothers who don't get so much of milk in their breast. And are there any breast milk banks in Delhi or in your hospital where they can, take breast milk? If you could just dwell on that a little bit, and then we'll move on.
If Gulpreet, if you allow me, firstly, I will dwell upon the milk supply for of a mother whose baby is normal term baby. Now, there we go through different processes. There we don't recommend breast milk banking. There, what we try to do is there are a few things. I'm sure mother comes to know that her milk supply is less. So we have certain ways of managing it. For example, we recommend, suppose we find that after discharge, if the baby is being passing, when they come for follow-up, we find babies passing less urine, less stool, and is perpetually hungry, his weight gain is inadequate, or he's had a profound weight loss, which is more than what is recommended. So we think that perhaps the breast feeding has been suboptimal.
Okay.
There we have certain things. What we do is we ask her to, in case the weight loss is not above a particular cutoff, we say, okay, we will give you some medicines. So we give some what is called lactocox, a medicine which stimulates breast milk production. We also ask her to improve her diet, improve her water intake, and then she should. We also recommend her to breastfeed the baby more frequently. So that's one way. Now you ask me about breast milk banking. By and large, breast milk banking is meant for either very tiny preterm babies or some babies who have some kind of a special sickness. So it's for special children.
Okay.
Breast milk banking is not meant for you know normal healthy babies whose mothers could not somehow produce enough milk. And you ask me, are the milk banks available in Delhi? Yes, I sometimes do get milk for my tiny ones, like those 800 grammers and whose mothers don't have, initial few days, they take some time to get the milk supply going. So we do get, this is from La Femme, and I think GK or some in South Delhi, I get. Uh, Kulpreet, I can't see you. Connection is lost or something?
Seems so.
Huh?
Yes.
Kulpreet, is the connection lost? बुला उसको ना, जाएगा नहीं ना वो.
से बुला रही.
Just call him. So I'm no longer Facebook Live.
No, sir. Sir, you don't say anything.
Yes.
Yes, you be there. So you be there, no problem. Just a bit back. वीडियो चला गया यार, कनेक्शन. हाँ. नहीं, देखो आके जल्दी से. Okay. हेलो. सर के कैबिन में. सर के कैबिन में. डॉक्टर अशोक. So from there they had a problem.
पूर्ण से.
हाँ. हेलो. हाँ जल्दी करो. तो मेरे ख्याल से वहाँ से प्रॉब्लम है.
अच्छा चल रहा है. It is going so well.
करो अब कनेक्ट एंड डू इट. ठीक है. हाँ ठीक है. हाँ.
Hi.
Hi, you're back. Sorry for the, I think the link was lost. Okay.
There was some technical glitch at my end, and
All right.
my system conked off, and I am just on the other system right now. So yes, sir. So we were talking about the breast milk in
Breast milk bank you talked about. So in summary, breast milk bank is for some special babies with some special needs. For normal, let's say today's talk is about normal newborns. So there, perhaps we do not recommend. We do not recommend breast milk, human milk bank.
Yes.
Yes.
No, I'm here. I'm here.
Okay. All right.
Your connection is good. Don't say anything extra.
Okay. All right.
So we were talking about, the milk bank is optimal for mothers who have preterm babies who have special needs.
Absolutely. Absolutely. Absolutely.
Great. So, sir, for normal babies, what are the signs of underfeeding? You had, you had stressed a bit while you were explaining it. Tell us in detail, what are the signs of underfeeding?
Okay. So many a mother has, that should I say, anxiety or apprehension that is my milk enough? So firstly, I want to say, I always tell my mothers, firstly, don't have any apprehension. Be relaxed about it. Now, first thing she asked me, how do I know my baby is getting enough? So that's a question. How does she know that the baby is getting enough? So there are a few perceptions at the time of breastfeeding. So I just enumerate those. One, that when the baby is suckling, she can feel a kind of a milk being suckled from her breast. So she feels it. She feels the milk flow into baby's mouth. Her breast Once the breast milk comes, her breast, which felt tense before feeding, they feel emptied and soft after having breastfed a baby. 2. 3. She can hear the gurgling sound from the baby's throat. So she can hear the milk flow into baby's mouth. And then she does see the milk at the corner of baby's lips. So she can see the milk flow into baby's mouth. So one is the perception at the time of feeding. That means she sees the milk flow into baby's mouth. She hears the milk flow into baby's mouth, and she can feel the milk flow into baby's mouth. That's one. Second thing, of course, is when the baby is hungry, he or she gives hunger cues. He or she takes hand to, let's say it's a baby girl, she takes hand to her mouth, it's called hand to mouth activity. The moment her cheeks touch something, like mother's clothes, her head, her cheeks, and her lips turn towards that side, it's called rooting. And then she makes those mouthing movements. So a brisk rooting, hand to mouth activity, and this mouthing movement suggests baby is hungry. Now, once he or she's had a nice feed, she will lose these hunger cues. Her fist will open, she'll be relaxed, and she'll fall asleep, and she'll sleep for at least 2 hours. Besides, a well-fed baby passes urine at least 6 to 8 times a day. Urine at least 6 to 8 times, and stools at least 3 to 4 times a day. So, after 4 or 5 days or 6 days, if you find a baby is wetting just 2 or 3 nappies, passing urine for 2 or 3 times, and stool once or twice, that suggests that perhaps baby is not getting enough, or baby is not able to sleep. He or she is giving perpetually those cues for hunger. So if the baby is perpetually hungry, is passing less urine, less stool, that suggests the baby is underfed.
Okay, so that's very well explained. That's very well explained, Dr. Saxena. I meet so many doctors in my career. I have never seen, doctors explaining it so well. You so simply explain, and I'm sure the mothers on Aspiring She platform will really cherish this information which you have given. So thank you so much for that, doctor.
Thank you.
Okay, tell us, does the baby need any other feeds, after 6 months?
Okay, okay, all right. Now, firstly, I would dwell upon the first 6 months. First 6 months, as we said, that there would be a tiny fraction of babies who may require what is called supplementary feeds. Today, we won't talk about it because then it will take away the message, and the message is breastfeeding. So, I would not talk about those minority babies who require some supplementary feed because I don't want to be doing that. Now, at 6 months, again, what I say is the only diet in first 6 months of life is mama's milk. And after 6 months, the only milk is mama's milk. That means after 6 months, mother's milk continues to give substantial nutrition to the baby and should be the only milk that the baby gets in case the baby has been exclusively breastfed. But we start some solid food. Now, how we go about it, I think it's a topic by itself because that would be in the realm of. I do take a talk on that. In fact, I have a write-up and I give it to all my parents. So we start some solid food like some cereals. Basically, our aim is to give a protein-rich diet, a calorie-rich diet, and iron-rich diet, and we introduce one by one. But again, as I said, the breast milk, in case it was the breast milk supply was there at first 6 months of life, it continues beyond 6 months. So, and we strongly recommend in a exclusively breastfed baby not to start cow's milk after 6 months. After 6 months, she continues breastfeeding and she starts some solid food.
Okay, that's well explained. Now some mothers come with a thing and they have this thing in their mind that my baby's mouth se milk nikalta hai ya nose se milk nikalta hai. So is it okay? Is it normal?
Okay. I think virtually every baby has this problem, or I wouldn't even call it a problem. It's so common. I will call it a physiologic phenomenon. So it's called. Some people call it curdling. positing, spitting. So a bit of milk coming out from the corner of the baby's lips, or sometimes occasionally from the nose, is perfectly normal. But if the milk goes a great distance like a projectile, that is a true vomiting. That should be looked into. So bit of positing or curdling or spitting is perfectly normal.
Okay. Now, this is like all about milk because we are talking about newborn care. So there's
Right.
a lot of other things to the newborn care. I've seen, new mothers always wondering, kab nilao, when do I give birth to my baby? So what
Right.
is the right time, the right temperature of the water, or how, So isme na all mothers are very. Some mothers I've seen are very finicky.
True.
I will give bath to my child in the afternoon only. Some are like, today I'm not going to give the bath to my child because aaj to bahut thand hai. So,
Correct.
these kind of small things. So, what is the right time of bathing, and what is the right way and the water used for bathing?
Now, one thing that we recommend is that there's a protective armor. I may call it Suraksha Kavach that a baby is born with. It's called vernix. It's a coating of a thing that he gets from the mother's fluid that surrounds him, and that kind of prevents infection. So what we recommend is let it dry off, let it fall off on its own. So it takes good 5 to 6 days, 7 days for it to fall off. So let's say after first 5 or 6 days of life, one could start giving a bath to the baby. That's one. So that means no bathing in the while the baby is in the hospital, because then there's a chance of cross infection. One. Second thing is you asked a very right question: where to give a bath? I personally feel that it should be in a room which is warm, where baby won't get cold, and which is clean. So I would not like to take a baby to a bathroom to give a bath to him or her. So place temperature. Now temperature should be such that the baby doesn't get cold in the process. So we would talk about temperature subsequently. What is that temperature at which baby is comfortable? So second thing, of course, is that the room should be warm so that baby doesn't get cold. Now you ask another very good question: what should be the temperature of the water that you are going to bathe the baby with?
Yes.
So the temperature has been mentioned as 38 degrees centigrade, but nobody has a thermometer. So what I say is that pour on the back of your hand. The mother can pour on the back of your hand and see that is nice, comfortable. Her instinct will tell her that yeah, this is okay for my baby. So again, she goes by her instinct by pouring on the back of her hand, and she feels yeah, this should not either be too cold or too warm for my baby, right?
Right.
And you said a few more things, tips about giving bath is that there are a set of doctors who feel that soap is not necessary, and I am one of those doctors who feel that at least first 6 weeks of life soap perhaps is not necessary. I do not recommend any soap, and the thing about giving bath is it must be quick. So let it be very very quick. The clothes should be ready so that baby is dried up quickly, and the clothes baby is dressed up quickly. Thirdly, ensure that the water does not fall into baby's eyes, nose, mouth or ears. So and when you're giving it, see that there are no splashes when you're pouring water on the trunk. So some people recommend that give a sponge on the face and give a bath on the rest of the body. I would perhaps go with that. But be gentle while you're giving bath to the baby, and be quick. So this is
Be
my
quick.
message. Be
हाँ,
quick.
ये
Be quick.
ये 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 इंटरेस्टिंग मैसेज है, बी क्विक. मैंने देखा है, देयर सम मदर्स हु विल कि चलो बच्चे को पानी में रखते एंजॉय कर रहा है, so you are advising something different. You are saying that be quick with the bath and don't let the baby be too much in water, because of maybe it might the baby might get cold. Is that the
At
reason?
least, absolutely. Because at least for first month of life, after 3 months, 4 months, 5 months, 6 months, perhaps baby will enjoy playing with water. But today's talk about newborn who's vulnerable, who can get cold very very easily, and there are a subset of patients, Kulpreet, who are taken to be absolutely normal weight, but they are slightly let's say babies who came 4 or 5 weeks too early, whose weight was 2.4 kilograms. Now, these babies, we treat them as normal weight babies, but they're also prone to, getting cold very, very quickly. And of course, the preterms are very, very vulnerable to getting cold. So these are the reasons that I would not recommend letting the baby or mother enjoy the bath for rather long periods. Okay.
Okay, great. That's a very valuable input, Dr. Saxena. Another thing, which I've seen and I know is that in India and otherwise also, I think mothers are ki, baby ho gaya, so now massaging is a must. Okay, so massage to एक must है यहाँ पे. So so when one should massage, which oil to use, and do we massage in the first 1 month or 2 months or not? Because we have seen babies being massaged from first month. I'll tell you my case. When I was born, my mother told me when I was born, this massage wali pulled my entire hand out और मेरा मेरा फ्रैक्चर हो गया. मैं 2 महीने की थी और मेरा हैंड्स दोनों फ्रैक्चर हो गए.
Could be. I'm so I mean, it's sad that it happened, but I'm delighted that you shared this with us because this is what I tell all my mothers कि ये वाली जो दाई करती है ना, ये खींच के ये नहीं करना है. So you have, I think you have answered the question yourself very well, and this is exactly what I said. Firstly, is massage very important? To my mind, Gurpreet, it is not very important, but every mother and every nani and every dadi does it, right? You agree or not? Every dadi.
Yes.
She has to do massage. कैसे वो तो फिर चलेगा नहीं. So what I do is I do not I can't antagonize the dadi or nani, right? You would agree that it doesn't pay to antagonize dadi. So what I say is, okay, if you're going to give massage to your baby, let's put some zing into it, some power into it, some punch. Punch doesn't mean a punch. Punch means something which benefits the baby. So what I tell them is, put the baby on your lap. So when do you start? Again, you start once it is babies that 1x has fallen off, 5 to 6 or 7 days. You are sitting on the bed, baby is on your thighs. Now what you do is you take some oil. We'll talk about oil later. And take some oil and use gentle rotatory movements like this and talk to the baby. In case she's awake, look into her eyes. So that means you've started period of eye contact. Tell her a story, sing her a song. So she's getting skin to skin contact, she's getting eye to eye contact, she's now beginning to look at her dadi or mummy or bua or, India, fortunately, we are very lucky to have a very extended family. So, of course, because of Corona now, this has all changed. So she looks into, her grandchild's eyes, look into and tells her, she sings her, nobody is Lata Mangeshkar or Asha Bhosle. Sing her a song, and it leads to better emotional development. It leads to better eye contact, and we feel that there's a kind of a bonding. So I feel that whether it's necessary or not, but you can make it. You can put a lot of things into it, and as you said, the kind of massage that those old time, professionals used to do it of pulling. I actually demonstrate, please do not do this. What you just showed to us, I actually, tell them, please do not do it. And I almost plead with them, do like this, right?
Yeah.
Now, which oil? Now you said which oil? I said, I am not an oil specialist, but what I've seen is in South India, they use coconut oil. And something to be said about coconut oil is, there are two things. One, it is authentic. It's so freely available. We know there'll be nothing spurious about it. Like olive oil that comes from Italy. One doesn't know when it started, what it is. But coconut oil is easily available, abundantly available. Second thing is, there is tremendous experience with coconut oil in South, right? It does not cause any skin rashes. So, and it is not so very expensive. So to me, that oil is as good as any. And I am especially against some synthetic mineral oils. I will not take names of companies. So in other words, you do not need any special baby oil or baby lotion. I hope I have answered that question as well.
Sir, that is a very big market, sir. You're killing that market.
So as I said, it is natural mothering, it's instinctive mothering. It requires no market products. the kind of mothering that we try to inculcate is could have been practiced 100 years ago with as much ease as
So
it can be done now.
a thought is coming into my mind. I don't know if it is right or wrong. दूध या दही से मसाज कर सकते हैं?
मैंने दूधो नहाओ पूतो फलो तो सुना है मैंने कहानी लेकिन somehow I am not very much in favor of it. People do with desi ghee or in Haryana they do with desi
Yes.
ghee. I have no, so I am saying, as I said, massage is not something that is so very essential. So the essential ingredients of massage are a gentle skin touch, eye to eye contact, being together, being in close, close to each other. So those things are most important. What you do it well is perhaps not so important. I hope that
Okay.
should
Okay.
answer the question. Right.
Yes. Thank you, sir. Another thing, Dr. Saxena, is very, basic to India. इसकी जब बच्चा पैदा होता है हम उसको काला टिक्का लगा देते हैं, राइट? तो हाउ अबाउट क्या काला सुरमा कहाँ डाले, कौन सा डाले, डाले कि ना डाले, मतलब इट्स लाइक mothers are, and dadis and old people are like, ये सुरमा डाल दो नजर नहीं लगेगी, बट सुरमे के और भी इफेक्ट्स हो सकते हैं. So
Right, right.
please throw some light on that.
Right, right. So in here, close to Delhi, I don't know how it is in Pune. On sixth day, when the baby comes to me for follow up, so I say, and he or she has some surma despite my advice. I say, "Aaj chhati thi kya?" So they have this tradition of chhati. So they apply. They are very apologetic. Sir, aaj hi maine lagaya. So why do we not recommend surma or kajal? Firstly, surma they may have lead. Now, lead can cause a lot of problems. It may have an impact on the brain. It may have impact on the bone marrow. It may cause severe anemia. So that's one. So there's a chance of lead exposure. Second thing, of course, is when you apply, just think about it. A dirty finger going into baby's eyes and causing injury and infection. Thirdly, any kind of kajal, there's an opening, which kind of communicates. There's an opening of a tube which communicates we call it nasolacrimal duct. So that provides that's a drainage system of the eyes into the nose. So you are going to block that opening, and that will again result in infection. So it can cause injury, infection, and it can lead to lead exposure. So that's the reason we do not recommend. So in other words, I tell them, देखो जब बड़ी हो जाएगी लड़की तो अपने आप eyeliner लगाएगी, तो बड़ा होने दो. पर अभी तो कम से कम there is no need of applying kajal. So our message is no kajal, no sir.
This is a very strong message. I mean, I have never seen a child in India without kajal.
Yeah, absolutely, absolutely. And they think कि eyes बड़ी हो जाती हैं. I heard that कि educated mothers, working mothers asking me, sir कि काजल लगाने से मेरी इसकी दादी ने बोला है कि आंखें बड़ी हो जाती हैं. So I said, look, this is not, it's no theory in science or medical science says so. So you know how it is.
Is there an alternative? Is there an alternative in black color which they can put?
Black color.
मतलब बेसिकली काजल का क्या है कि काला है वो, तो काला है तो नजर उतरेगी. So the mindset is black color. Black से नजर उतरती है. So is there any alternative to use something black instead of kajal, which is not harmful?
Right. Now you see, whatever I said was against applying it in the eyes, right? So that was so. Now, if you want to respect dadi's emotions or nani's emotions, I said, okay, ठीक है, टीका लगा दो. हालांकि personally, if you ask me, I'm against any kind of irrational superstition. But sometimes, you have to succumb to dadi's wishes or accord to her wishes. So I said, ठीक है, आप टीका कोई भी लगाना है तो लगा लो, कोई सा भी काला टीका लगा लो. But I am personally against all these superstitions. As I am a rationalist, so I guess so you can apply. If you want to apply anyway a color tika here, might as well be kajal or whatever it is. But personally, I'm against any kind of irrational superstition.
Okay. So what doctor is saying कि आपको काजल नहीं लगाना है, कतई नहीं लगाना है. अगर आप लगाएंगे, you are harming your child. So please do not harm your child and put kajal at all. And he is also advising that don't put any kind of external element of infection near your child's face, at least in the first 6 months to 1 year. That's, I think, what he's advising. So please, it's a very valid advice from the most experienced pediatrician and neonatologist in India. So I am sure that you are going to respect that. And please take this advice and spread it all across the new mothers you come across. So thank you for that advice, Dr. Saxena. Another thing which is very important, which I want to ask you is, when does the umbilicus fall off? And how मेरे को पता है कि क्या बार क्या होता है कि वो अम्बिकल वो बाहर रहता है, तो कई बार वहां से इन्फेक्शन जाती है, पानी डल जाता है, और उसके भी बड़े सारे फादर के अपने क्वेश्चंस होते हैं, मदर के अपने होते हैं, पेरेंट्स के अपने होते हैं. सो हाउ टू हैंडल दैट सिचुएशन, व्हाट इज द राइट वे?
Okay. Now there are there are two ways of looking at it. Let's look at a baby who's born in a very clean environment. Let's say in a hospital, which is all the facilities. There, what we recommend is called dry cord care. That means you don't apply anything. You just keep it dry. Now, you may ask why. See, again, it is nature. There are some, when the baby stays with the mother, he gets certain friendly bacteria. We call them saprophytic bacteria. And they lead to healthy separation of the cord. So, for babies who are born in a clean environment and were delivered properly with a clean and sterile knife, blade was used, or cord cutting scissors was used as we do it, the proper clip was applied, there is no need to apply anything. So it's a very big statement I'm making. Most of the babies delivered in clean environment and who are delivered in ideal conditions require nothing except dryness. Nothing is to be applied. However, in case the baby was born suddenly, unexpectedly, where the cord had to be cut in a very in a less than desirable fashion, or where the mortality is high because of infection, because of the unhygienic conditions, some kind of antiseptic application on the cord is recommended. There are various things, I don't want to go into it, but again, they recommend 4% chlorhexidine, for example, under such conditions. But again, I am not in favor of repeated application of these chemicals because they do get absorbed in baby skin. So even if the baby is born under such circumstances, application once is all right. But I don't see why a baby who's born in my hospital should apply neosporin powder her or his parents should apply neosporin powder, because it actually absorbs the moisture and makes it wet, right? So which is against the tenet of dry cord care. So in nutshell, dry cord care for babies who are delivered in ideal conditions, but we may use some antiseptic, should I say chlorhexidine, for example, once or twice in the cord of the babies who were delivered in less than ideal conditions. I hope that answers the question.
Yes, it does. It does, and very well. And I've also seen, and I know that mothers and Indian community वो oil जरूर लगाना navel में. और उसकी क्या उसकी क्या कहानी है?
Yeah. Oil, Kulpreet, when about 30 years ago, when I was doing my MD Pediatrics, I was at base hospital or army hospital, and we had babies coming from nearby villages where they apply cow dung, and that would cause tetanus. So all that was done. So it's not so long ago. I mean, to me, it doesn't appear so long ago. So you're right. As I said, nothing is to be applied on the cord. So nothing means nothing actually. I just tell them, just leave the cord alone. A few things about cord. You said, when does it fall? I have not answered that question. Usually it falls usually speaking, falls within first 10 days of life. When it falls off, there is slight brown discharge, or slight, just a bit of blood from the cord, and it dries up within no time. But if there is a constant bleeding or there's some pus discharge, then you got to show to the doctor immediately. So by and large, it falls within 10 days of life. And when it does, as I said, there might be just a tiny bit of brown discharge or a slight bit of blood, but then it dries off. All right.
And after that, anything to be applied?
Nothing is to be done. Just nothing is to be done.
Okay. So that also clears a lot of misconceptions and myths around it. You know. Okay. Now, doctors are moving a bit forward on newborn care. There are a lot of mothers who complain that my baby passes stool after every feed. Diarrhea तो नहीं हो गया है, या is it normal? So what is the digestive system of a newborn, how it performs? Tell us something about that.
Okay. So, if you remember, we said that the definition of adequate breastfeeding was stools at least I said at least 3 to 4 times a day. Now, what happens after 7, 8, 9, 10 days? Mother, when she comes to me, she says, "My baby, doctor, my baby is passing stools after every feed." I'm very happy. I tell them I'm very happy. That means, and lo and behold, the baby has gained weight satisfactorily, or sometimes more than satisfactorily. So it is normal for a baby to pass stools after every feed, and it is very reassuring when you find that it is accompanied by adequate urine output and adequate weight gain. So, especially in a breastfed baby, passage of stools after every feed is perfectly normal.
Okay, because that's a concern with a lot of mothers. Okay, another thing is that mothers can never know that why is the baby crying.
True,
So what
true.
are the signs a mother can get when the baby is crying?
Right, right. So there are a few reasons, and there are also, again, there are a lot of theories in our country that how should we respond to a crying baby. First thing, of course, is what are the common causes? A hungry baby would be crying. A wet baby would be crying. So we know that. So we tell them, if the baby is crying, see that she is not wet. See that she is not soiled her nappy, right? And also see that she's not hungry. She's not showing you cues for hunger, like taking hand to mouth, as I said some time ago. Now, if she's had a hearty meal and she's not wet, what she wants is, "Mama, just pick me up." She just wants to be held. So I just tell them, please do not let your baby cry. Just pick her up immediately. This is my message, which is in contradistinction to what the others say, that उसको तो रोने के आप स्पॉइल कर रहे हैं बेबी को, अगर आप उठा रहे हैं, आप उसके फेफड़े खोलने दीजिएगा. This is not correct. So it is proven that there are two reasons for not letting the baby cry. So first message is, in case she is not hungry and she is not wet, kindly pick her up. Sometimes dad may have to take the baby on his shoulder and do what is called pacing. He may have to walk, and baby will be happy as long as she's on dad's shoulder or mama's lap. The moment she puts her down, she starts crying again. So that is perfectly normal, and it's a justified emotional need, and we recommend that you should hold the baby and not let the baby cry. There are two advantages of that. One, she learns to trust this word. She learns that this word is a loving word, and against that, it is also said, the babies whose parents don't pick them up on crying learn to be aggressive. They learn to distrust the word. That's one. So that's a long-term thing. The short-term thing, of course, is if you do not control babies crying immediately, it'll be very difficult to control her. And then it will become what is called inconsolable crying. And there are reasons for inconsolable crying. So for two reasons, then you will be rushing to the doctor. So these two reasons. So I just what I've in summary, in case she's not wet or she's not hungry, pick her up and she'll be quiet. And attend to her emotional need immediately. All right.
Wow, that's very nice.
Okay. Of course, there are other reasons for crying, which I'll come to, what are called warning signs, where the baby is inconsolable, is been crying for 3 hours or more. That's entirely a different set of pose a different sort of challenges, and I think maybe we'll talk about it a little bit later. All right.
Yes, great. So, doctor, it's almost an hour that we are chatting, and एक घंटा कैसे निकल गया पता ही नहीं चला. Such valuable information, and we have few minutes left, so we'll kind of start closing our chat. And 2, 3 very important questions which are left. I wanted to ask is jaundice normal? Number one. And a very important aspect is about immunizations at birth. So
Right.
these two things I would like you to answer, and then we can have a consolidated, suggestions coming from your end, and then we can complete our chat.
Right. So jaundice is seen in two-thirds of babies, so it is normal. But first time when the parents notice it, they should show to a doctor because a good number of patients may require some treatment. So let's say
Okay.
about 5% of babies, it is estimated, may require some kind of treatment or some investigation. So even when it is two-thirds of babies show jaundice, kindly show to a doctor once so that let him assess or let her assess, let the pediatrician assess whether it requires some, investigation and it requires some treatment or not. Right?
Okay. And give us some suggestions on the immunization
Right,
vaccine.
so at birth, what we give is a BCG, which is against tuberculosis. We give polio drops, we know that, and we give hepatitis B vaccine. So that is against a particular kind of a virus which affects the liver. So these three vaccines are given at birth, and we ask them to follow it up with next schedule, which we conveniently schedule around 6 weeks of life. All right.
Okay. Okay, that's I think very valid. So thank you, doctor. Thank you so much for your time. And we are towards the end of our chat on newborn care as a part of 15-day online awareness campaign by Aspiring She Foundation. So, doctor, before we end, if you could give us a list of recommendation, from our talk as a takeaway.
Right, right. A few things that I want to say is that perhaps one thing that I think I've not covered is one is that when to rush to a doctor. So one is that either babies, I always say either the babies are absolutely well and they require no treatment at home, or in case these issues crop up, then rush to a doctor immediately. Do not do any self-medication at home. So in case baby is not been taking feeds properly, baby's got fever, there is vomiting which is going far distance, baby's turning blue, white or yellow, is being crying incessantly for 3 hours at a stretch, inconsolably. There's abdominal distension, there is cough, there is breathing difficulty, there are seizures. So, any such thing, please, whenever you are anxious, do not take any advice of anybody around you except so you must go to the doctor immediately. That's one part. Secondly, as I said was that the mothers are, to me, they are like God, and God has given them all the instincts, all the intelligence. They should just trust themselves. Don't discuss, with your friends. Try to share it. Somehow it doesn't work out. As you said, every mother is special, every baby is special, and this mother-baby diet is special. They are made for each other. So what her experience may not be their shared experience may be different from a shared experience of other mothers. So I personally feel that she should asking people who do not know much may be harmful. So it's better to trust yourself. And in case you have a doubt, just consult your doctor. This is in a nutshell, is my advice.
Yes. Thank you so much, Dr. Saxena. It was wonderful chatting with you. Some, amazing and very valuable inputs on newborn care, which every mother is concerned about. So thank you so much for taking out time, and we'll keep in contact with you. And definitely would like you to bring here again for our audience.
Thank you, Kupi. Thank you so much. It's been a pleasure
Thank you, sir.
as well. Thank you so much.
Thank you, sir. Thank you. So, this is a part of 15-day online awareness campaign by Aspiring She Foundation on maternal health and childcare. And it has been supported by Ma to Mom and health partner Nurture IVF and supporting partner Impact Health. Thank you very much, and we'll soon be back with more knowledge and more information for our audience. Thank you.